3, 2, 1.
Hello everyone, today I demonstrate on how to suctioning. Suctioning is oropharyngeal or orotracheal suctioning, nasotracheal or nasopharyngeal suctioning, and the tracheostomy suctioning. First, gather the supplies: portable suction machine, clean suction catheter, sterile normal salines, and resuscitator bag, also known as the embo bag. Also PPE, mask, glove, lubricants, and towel. Before to start, always remember, check portable suction equipment to make sure all tubing connections and collections jar have a tight seal. Place portable suction unit to an electrical outlet and turn it on. Set the portable suction pressure should not be set higher than 15 mm of mercury. Check pressure by turning the machine on and covering the open end of the suction line with one hand. If the pressure does not go up, recheck all tubing connection or adjust to the correct pressure. Ensure privacy and introduce yourself to the patient, and then verify her name and date of birth, and then place the pulse oximeter on the patient's finger and leave the device in place. And also help the patient into the semi-polar position. Insert the catheter into the patient's mouth, moving along the gum line toward the pharynx. Apply suction and move the catheter around the mouth until all secretion had been cleared. If the patient has an oxygen mask, replace it. Now, suction water or normal saline through the catheter until the connecting tubing has been cleared of secretion with the suction turned off. Wash the patient's face if needed. Then, remove the drape and place in the trash or laundry if it is soiled. If she has a diminished level of consciousness, help the patient into the same position to encourage drainage. Store the catheter in a clean, dry place, for example, in a bag attached to the bed rail. Help the patient into a comfortable position and do some oral care and get toothbrush and perform mouth care as needed. Discard the remaining water and then remove your gloves and mask or face shield and dispose of them properly. Perform hand hygiene. Document the procedure, including how well the patient tolerates the suctioning. Note the amount, consistency, color, and odor of secretions. For performing nasotracheal and nasopharyngeal suctioning, encourage the patient to cough. Replace her oxygen device and instruct her to inhale deeply. Assess for the need to repeat the suctioning procedure, but don't perform more than 2 passes. Watch for alteration in the patient's cardiopulmonary status. When possible, allow adequate time, at least 1 minute, between suction passes to allow for ventilation and oxygenation. Rinse the catheter and connecting tubing by suctioning normal saline until the catheter and tubing had been cleared of secretion. To recording care is adequate suctioning of the secretion through the tracheostomy tube. The humidification of air. This can be done with humidified air attached to the tube. Placing a humidifier or steam near the patient bed or applying a wet porous gauze onto the tracheostomy tube, although the latter is considered a crude measure. And always keep the patient under regular supervision and ensure that the tube is functioning and not dislodged. Since the tracheostomy forces the air to bypass the vocal cords, patient will not be able to speak effectively. In such cases, a notepad and bell should be provided to the patient to allow them to communicate effectively. Help the patient into a comfortable position. Perform hand hygiene and document the procedure, including your pre- and post-suctioning assessment, the amount, consistency, color, and odor of the patient.